Hello, I'm Julia Walters, Communications Specialist with Kingman Regional Medical Center. You're watching our COVID-19 update series, keeping our community and staff informed about issues surrounding the pandemic. Today, I'm going to be talking with Dr. John Ashurst with our emergency department. He'll tell us about symptoms, spread, and prevention of the transmission of COVID-19. First, we'll go to Jim with today's numbers update. Go ahead, Jim.
Thanks, Julia. As of today, August 4th, we've tested 6,436 patients for COVID. Out of that, 403 are positive, 5,833 are negative, with 200 pending tests that we're still waiting on results for. We're holding steady and maintaining a positive rate of 6% of those tested. Currently in-house today, we have 16 patients on isolation or rule-out. 14 of those are positive with 2 rule-outs. Back to you.
Next, I'll be speaking with Dr. Ashurst. Dr. Ashurst, thank you for being with us today.
Yes, no problem.
We're going to go over some general information about COVID now that we've learned a little bit more since the beginning, as far as what the symptoms are, what the spread is, and what to do if you're sick. So if you could start by just kind of telling us an overview of how the virus spreads.
Yeah, so the COVID-19 is mostly spread through the person-to-person of the transmission. With that, it's being in close contact with someone that's been known to have COVID, and being in that close contact, if they cough, if they sneeze, if they talk, those droplets, then you inhale them, and they can get in your nose and your lungs, and that's then how you would end up having the COVID-19.
Okay, great. And so since the beginning, we've kind of expanded the list of recognized symptoms as we learn more. Yeah. Can you tell us what the symptoms are?
Yeah, so the symptoms can end up coming on any time between 2 days and 2 weeks after you've been exposed. So originally we thought the symptoms were just cough, being out of the breath, and the temperature of higher than 100.4. However, now what we're also now seeing nasal congestion, throat that's sore, nausea, vomiting, loose stools, the loss of the taste and smell also. Also, we tend to see people do have like some weakness, aches and pains. So the symptoms can range from those big symptoms that we saw at first, and also now these mild symptoms, just as the nasal congestion and runny nose.
Okay, great. So now we're going to talk about prevention. What can we do as individuals and as a community to prevent ourselves and others from getting sick?
Yeah, so right now the best things would be to keep the distance from each other, as well as doing hand washing. And one of the most important things is actually having on a mask. One of the things that I see in the ER is the inappropriate use of masking. So we have to remember, when you are putting on a mask, what you do is you wash your hands first. After you wash your hands, you then put the mask, the loops over your ears, and you tighten it down here at your nose. You tighten it down on the sides and make sure it's covering your chin.
Okay. So if a member of the community or anyone thinks they have COVID-19 or they've been exposed, what would be the next steps?
Yeah, so the most important thing is, if you think you've been exposed or if you think you have COVID-19, is to end up doing self-quarantining. You should end up being at home. One of the other things that we're recommending is that you end up logging into the Care Anywhere software. That way we can kind of talk to you to see if you need a test or not. But the most important thing is, if you think you've been exposed or if you think you have COVID-19, is to self-quarantine at home.
Great. And for how long?
Yeah, so that is dependent on your exposure risk, as well as the recommendations. So the recommendations are being updated basically weekly. Currently, if you think you have COVID-19, it's a 10-day quarantine at home, but you also have to not have a fever for 1 day and improvement in your symptoms. If you've been exposed and you don't have any symptoms, the quarantine recommendations are based upon your risk of exposure. So it is actually possible that you could quarantine longer than someone that actually has the COVID-19. So say you live in someone's home that is still contagious, you could technically quarantine for 16, 18, 20 days.
Okay. Because
you're still being constantly exposed to a person who's contagious.
Right.
And the time period to develop COVID-19 is actually up to 2 weeks.
Right. So that's the reason. You need to wait for them to kind of get past it.
Correct. Yes. You want to make sure that they're no longer contagious anymore before your 14-day quarantine starts.
Right. Okay. That makes sense. And for our viewers, that Care Anywhere website is krmc.zipnosis.com. If you think you have symptoms or you think you've been exposed, you can do a virtual visit with Care Anywhere and get some advice from a provider. Dr. Ashurst, do you have anything you want to add? No,
I think that's all. So yeah, if anyone has any questions, the easiest way to get a hold of me is actually on the Care Anywhere software. Happy to answer anything.
Great. Thank you.
Yep, you're welcome.
Thanks for watching. For updates, follow Kingman Regional Medical Center on Facebook or visit azkrmc.com/COVID-19. Until next time, stay safe.